Skim Perlindungan Kesihatan Nasional Mysalam merupakan satu inisiatif kerajaan bagi membantu golongan B40 menangani kesulitan kewangan apabila dimasukkan ke hospital kerajaan atau ditimpa penyakit kritikal. Setakat ini, Mysalam terus mendapat reaksi positif masyarakat, tetapi kesedaran golongan sasaran berkaitan program berkenaan masih rendah dan ia melibatkan kira-kira 3.8 juta penerima yang terdiri daripada individu yang juga penerima bantuan sara hidup rakyat.
As for the introduction, I would like to talk about Mysalam. So, what is Mysalam?
Mysalam is the B40 protection SIM, which is a free takaful protection SIM provided by the government to the B40 community in Malaysia. This SIM is managed by the Ministry of Finance Malaysia through the Mysalam Trust Fund and is fully managed by Great Eastern Takaful Berhad. It is designed to operate for 5 years, starting from 2019 until 2023. But due to the positive feedback from Malaysians, government has agreed to extend this SIM until 2025. Not only that, this SIM gives two types of benefits, namely hospitalization benefits and critical illness benefits. Hospitalization benefits are in if Mysalam recipients are admitted to a government hospital ward, university hospital or armed force hospital, they are eligible to claim a replacement income of 50 ringgit per day, and it is limited to 14 days or 700 ringgit per year. For critical illness benefits, if Mysalam recipients are confirmed to be suffering from one of the 45 types of critical illness such as cancer, the recipient can claim a benefit worth 8,000 ringgit from Mysalam, which will be paid in full to the recipient's account once in a lifetime.
I'm going to talk about the policy problem. The creation of Mysalam involved overcoming key challenges. First, the government had to address the financial of the B40 group, whose members were often burdened by high medical costs. Despite subsidies, treatment for serious conditions remained unaffordable, and the government needed a solution that ensured financial protection. Second, raising awareness about the importance of insurance was difficult, as many were unaware of or discouraged by private insurance options. Lastly, gaps in existing welfare programs like Bantuan Sara Hidup meant that long-term healthcare costs were not adequately covered, requiring integration into the Mysalam framework.
I will explain about the objective of this policy. The Mysalam scheme is one of the healthcare aids program offered to Malaysians, and the country has supplied a number of healthcare assistance to its citizens. It is part of the government's effort to help and facilitate the lower income group or the B40 household to resume a normal lifestyle despite the financial challenges arising from critical illnesses. Its goal is to assist the poor and needy in overcoming financial difficulties in the unexpected event of critical illness. The B40 household can apply for the plan in March. It was first offered in 2019. Since most B40 households are struggling financially, especially in terms of their health, Mysalam is a Malaysian government healthcare assistance scheme that targets low-income households to lessen the burden on them. The program is associated with the capacity approach, which examines if the program can enhance the well-being of its beneficiaries, the B40 household. The reason for this is that the majority of healthcare insurance policy don't seem to help people's health because of the high costs that aren't covered for some serious illnesses, which have caused poverty for the majority of low-income people worldwide when they have to pay for their own medical care. Additionally, the scheme covered 45 serious diseases for which the majority of medical costs are higher than those for other conditions. Because the majority of the serious illnesses included in the scheme are extremely expensive for B40 household, it is crucial to assist if the scheme can improve their health. Several strategies may be used to guarantee that the Mysalam policy successfully achieves its goal of offering health protection to Malaysian B40 populations. The first strategy is enhancing awareness and education. Seminars and instructional sessions hosted in neighborhood and community centers, education institutions, and house of worships are few examples of these programs. This initiative can give true explanation of the Mysalam scheme's operations, advantages, and eligibility requirements by interacting directly with the community. In addition to demystifying the policy, this in-person engagement enables potential beneficiaries to ask questions and provide prompt feedback which can improve comprehensions. Using digital channel is another successful strategy for increasing awareness. A wider audience may be reached by social media campaigns, targeted online ads, and educational films, especially younger audience who are more prone to use the internet to obtain information. By producing captivating material that showcase recipients' achievements, this may encourage others to find out whether they are qualified for the program. Additionally, creating a specific website or mobile application that allow users to learn more about Mysalam, verify their eligibility, and even file claims will greatly improve accessibility. Stakeholders may greatly increase participation rate within the B40 group by putting these multifarious techniques into practice to raise awareness and educate people about the Mysalam policy. In the end, this will guarantee that individuals who require health protection the most get assistance they need on time.
The next strategy is, firstly, building a communication network and interaction with target groups toward widespread information marketing. Secondly, implementing field programs to reach target groups, especially those living in rural areas. And lastly, monitoring and collecting and analyzing important data as a basis for formulating a strategic communication plan to achieve the effectiveness of government information marketing and also addressing current issues.
I would like to present about the strength of Mysalam scheme. One of the strengths of Mysalam scheme is to lessening the financial burden of the B40 group. This is because mostly people from the B40 group deal with difficult financial circumstances while dealing with chronic diseases or other health related concerns. So Mysalam work as a healthcare insurance makes it possible for the people to receive care. Advantages such as cash rewards, discount, free treatment can help this B40 group to maintain their health and also improve their well-being. Maintaining their health with a chosen plan will reduce the incidence of chronic diseases such as heart attacks. This can be seen from the patient of 56 years old reported that Mysalam was a huge benefit to them after receiving settlement for their claim within a week. So this scheme genuinely has enhanced the recipient's health by offering a reasonably priced treatment that enables them to enjoy a healthy life.
And next, for strength, Mysalam has strengthened Malaysia's social safety net by addressing critical healthcare challenges faced by the B40 group. It bridged the financial gap by offering free coverage for 45 critical illness, helping families avoid financial ruin due to medical expenses. For example, many beneficiaries with conditions like cancer now receive essential support. It also promotes preventive care, improving early disease management aligned with Sustainable Development Goals, known as SDG, Mysalam boosts public health and economic stability, proving its resilience during crises like COVID-19 by expanding coverage to pandemic-related illness.
So let's move to the weaknesses of Mysalam. So the first weaknesses is that it is insufficient to cover the needs of B40. While this scheme has been extended to a broader population, it may not be sufficient to address the comprehensive healthcare needs of the bottom 40% of households. This is because the high cost of medical treatment, particularly chronic disease and complex procedures, can surpass the one-time cash payment offered by Mysalam, which is only up to 8,000 ringgit following the diagnosis of one of the 36 critical diseases, in addition to placing a significant financial burden on the B40 family. This can force them to make tough choices like delaying and skipping necessary important treatment, which can ultimately impact their health and well-being. Not only that, but the continuous expenses associated with chronic disease, such as medication, periodic examination, and specialized treatment may put further strain on their limited financial resources. Therefore, it is the responsibility of every policymaker and all insurance to find innovative solutions to address these urgent problems. By combining the strength of both, it is possible to develop a sustainable and durable strategy to guarantee that B40 households have access to the healthcare service they require, even in cases of poor health.
And next, for weakness, one of the weaknesses of Mysalam is limited awareness and outreach have hindered its effectiveness. Many eligible individuals from the B40 group remain unaware of the program due to inadequate marketing and outreach efforts. As a result, they miss out on potential benefits. Additionally, the absence of aggressive communication strategies contribute to skepticism toward government-led initiative, making people hesitant to engage with the program. This communication gap prevents Mysalam from reaching its full potential in providing crucial financial and healthcare support to those in need.
So moving on to the recommendations, one of the recommendations for the government to improve the Mysalam scheme is to raise the amount from time to time according to the suitability for the schemes. So we have seen improvement before this, such as the programs will be extended until 2025, where before this it was announced only until 2023. Not only that, another improvement made by the government for Mysalam is where Mysalam schemes now covers over 45 chronic diseases as opposed to 36 chronic diseases it covered in the prior years. So we know that the patients will be given about 8,000 ringgit for critical illnesses. It was good, but government can raise it from time to time, since we know that 8,000 ringgit might not be sufficient to cover all of the expenses. So this enhancement can contribute to the long term of excellence health of the B40 group. So for the second recommendation is government can do a road shows in public places like malls, universities, and concentrating on remote areas in Peninsula, Sabah, and also Sarawak. Although this has widely publicized, but people from the B40 group are unaware of this program and could not manage to register for the Mysalam scheme, particularly those living in the remote area. So within these road shows, it will help people from those remote area to improve their knowledge about how, and it offer a convenient way for the people to obtain information without having to shell out a lot of cash.
In conclusion, Mysalam, a government initiative created to lessen the financial burden of critical illness among the B40 population, has proven to be a crucial step toward improving their overall well-being. By offering free access to healthcare, Mysalam enables B40 people to prioritize their health and lead more normal life. Even when dealing with serious health conditions, This initiative enhanced their productivity and quality of life in addition to reducing the financial strain brought on by medical expenses. Additionally, Mysalam complete coverage guarantees that B40 patients receive appropriate medical care, which lowers the risk of complication and improve their chances of recovery. By reducing financial barriers to healthcare, Mysalam empowers B40 people to focus on their health and well-being by reducing the cost of healthcare, which eventually makes the country healthier.